times get hard, and we're here to help at NorthPoint.
Hello and welcome to another episode of NorthPoint's Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing healthy aging with NorthPoint Community Health Worker Program Coordinator, Ms. Peggy Moore. Peggy has been with NorthPoint Health and Wellness Center for over 13 years. She is passionate. When I say passionate, I mean passionate, folks. She is passionate about working with seniors and making sure they are healthy, safe, and have the resources when they need them. She is committed to building strong community connections through impactful programs and outreach initiatives. Peggy is the proud mother of two beautiful grown adult girls. She has 4 grandchildren ranging from 1 year old to 28 years old, and she has 1 great-great-grandbaby who will be 3 years old this month. Welcome, Miss Peggy.
Thank you.
Thank you so much for being here. We are just very pleased that you're here talking about this topic. I know you have a lot of passion around it. So I'm going to start right away and I'm going to ask you, what does healthy aging mean to you and why is it important?
Well, it's important to me because aging well means maintaining your well-being mentally, physically, and socially. And I mean continuing to grow and to take care of yourself. So the importance of aging, I think, is it's an intentional thing, right? And so to me, I just want to make sure that we're mindful that it's something that can be done, and that we just have to be intentional, and we have to make sure that when we're aging, that we're having those conversations about our seniors having what they need and that they can continue to grow.
Well, let's talk about your journey. You've been here at NorthPoint for 13 years. That's a long time. Congratulations.
Yes. Thank you.
Yeah, and you love this work.
Yes.
You didn't start in this work, though, when we sat down to talk, right? Tell us a little bit about your background and how you got here.
So when I first came here to NorthPoint, I was working with the breast cancer awareness program with the ladies and men sometimes, but educating them, letting them know the importance. So it's kind of, I've always worked with the middle to older adults. So that's how I came about this work. As that kind of ended, we had this awesome opportunity to work with Alina, and they had it was called Life Course, and what it was, where we went into the assisted living, into the seniors' homes, and actually did monthly visits to make sure that they were getting the resources that they need. We started with the providers, making sure they had a provider, and making sure they kept up with their appointments, medications, and things like that. So then that kind of winged out, and then we were able to secure funding to do living and aging well at home.
Right.
And that was where I really found my niche.
That was pivotal for you at that point, right?
Yes,
Yeah. And you talked, when we were talking, I think you mentioned that some of those programs, some of those aftercare programming for seniors and vulnerable adults are not necessarily geared towards our community that we serve, right?
Correct.
Let's talk about that a little bit, because then you can get into your living well.
Yeah. After having that training that I had through Alina, which was a wonderful program, mind you, because I believe it was like annual thing. So every month you had different topics that you brought to the senior and talked about their families, right? And so after the training was over, which lasted about 4 or 5 months, it was deep in depth. It was like you were going to school for psychology, because it was emotional, taxing, but it was wonderful. So then when it came to go out and to really do the work, to go into the homes. We were in environments that didn't look like us, right? Yeah. And just saying Edina, I couldn't relate. I saw that there were needs, but when it came to our community, it wasn't the same. Yeah. These were retirees. They had pensions. They had a lot more resources than we had. Yeah. So it didn't really line up. So we had to make sure that we tweaked it so that it would be something that would be relatable to our community.
Sure. Let's talk about that. Let's dive a little deeper. So as someone who does community engagement in healthcare, what are some of the things that we see in our populations that we serve here at NorthPoint? What are some of those scenarios that you're talking about?
Well, first of all, retiring, being on a fixed income. Sometimes it's husband and wife, sometimes it's just one person, but the finances aren't there for them to get the resources. Their homes need to be fixed up. If they need to get accessibility materials and stuff,
things like that,
they don't have those things available to them. Where in other neighborhoods and other communities, they have systems in place to help them. So that's one thing, and even nutrition. In our neighborhood, we know that just having healthy fruits and vegetables. So I'm so grateful for what we do, but it's a desert over here, so you have to be mindful of that. So there's a lot of things that we just in our neighborhood is just different. Community, families, things have changed, so just like if you go to purchase something, the first thing they say is, can your family put this down, or can they do this if you don't have it? Right. We just don't have it. So making sure that I have learned to really be intentional and listening what those needs are, because they vary. Yeah, they vary.
Yeah, and just approaching each individual and meeting them where they are for those needs.
Correct.
Yeah. Okay. Well, what are some preventative healthcare measures that we feel our older adults should be prioritizing? What are some things we want to be thinking about as we're aging?
And I kind of smirk a little bit because I'm there, right? So it's real. So being mindful that we keep moving. That we keep moving. It's not just moving, it's how you move, right? Understanding that, first of all, making sure you have a provider or someone you can talk to. So make sure that you're getting the guidance from someone like a provider, your doctor. Making sure that you're always interacting with them so that they can actually give you some guidance to fit who you are. So preventing, you want to stay active. You want to make sure you're eating a good diet. You're making sure that if you can get out and socialize, do that while you can. Family is so important. And staying connected. So the main things, and making sure that if you are going to move, make sure that you understand moving slowly. It's okay. It's okay.
Yeah, it's okay to be slow down. We were talking about that earlier. This is a season of slowing down and appreciating things, and taking a beat, pausing. Right. I know that some of our seniors, they have so much, they have this amazing lived experience and so much gifting, and I know for some of our seniors, they find themselves in isolation, right? And I hear you talking about the importance of maintaining those connections socially with family. What do you think are some ways to help foster that?
Well, number one, what I've been able to do I've noticed when it comes to resources, there are senior adults. So they are. There's some gatherings that take place quite a bit, but it's about seeking them out, right? It's wonderful if you have family that can help guide you, and sometimes that's just not the case, right? So trying to make sure that our seniors are aware that there's a day center that's wherever it is and what they
Yes.
offer. What I find myself doing a lot is sending out blast emails to my seniors about different activities that are going on in the community. Like just recently, Sister Spokesman. Then we had Breast Cancer Awareness Month. There were different activities going on. I make sure my seniors know, and I go out and I see them engaged, and that's important to me. But I'm always sharing, and then we have even a men's group that actually some of them are over 60, so I make sure they get those engagements just to know that there are things going on, and we got some new things coming up as well that I'm really excited about. But I'm always trying to share.
Yes.
And make sure that my the guests or patients or whatever you might want to call it, because now I'm wondering now, I'm a senior, so when I say senior, that seems so out of touch, right? So my thing is making sure that I understand that we all need to be engaged. So that we can stay active, you know.
We are designed to be in community. Yes.
And you said something that was important, the wisdom, lived experiences. And some of our seniors that, you know, they get in their places where they don't feel as valued and we just got to let them know how much we appreciate them.
Yes.
And I am a person that loves to sit and listen.
Oh, yeah.
You know, quick to listen, slow to speak. So I can learn some of those different nuggets that they have.
Right.
And I think that's why I realized this is my passion. Starting as a little girl, I didn't know why I sat up under my grandmother. She, Mama T, she passed away at 104.
Wow.
To listen to those stories.
Yeah.
And at 80 and 90, she was going to visit the seniors and sitting and communicating and socializing. So that's very important. So whatever you need to do, if they can't go, then finding out some kind of way where we can make a connection and someone can go visit them.
And you know, so much of that in our cultures, our BIPOC community, that oral tradition, that's part of our history, right? That's how we've learned and come up, like you said, at the knee of Grandma Maisie or whoever is hearing those stories. And so that's very important to us culturally, I think. What when I think about NorthPoint and what we do to support our seniors, I know that our volunteer engagement coordinator, for example, she loves to have our older population come and, you know, help with all the different activities we have here, voter registration, you know, healthcare center week. What are some other ways that NorthPoint is engaging our seniors?
Right now, I have a long, huge list. Partners. Right?
Okay.
We have created some awesome partners. Our seniors, the YMCA, making sure that our seniors who can and are able can go out and be able to go 2 or 3 times a week to be able to go and engage and socialize and be able to still move, right? So that's one of our partners. And then we also have West Ministries, which is downtown Minneapolis. It's a big, huge, beautiful church. I work with this young lady who is amazing, and she brings the seniors together. She sends out a monthly letter, and there are different activities every day. You name it, she's doing it, right? And so we partner, and so my caseload that I have and the seniors I work with, we connect with one another. So we kind of collide with each other. NorthPoint right now just started the Walk and Talk with the Doctor.
Oh, sure. Okay.
Dr. Gilliam and Dr. Price Yusuk. They are amazing. So we just started this program. We've walked twice.
Are y'all mall walking? Are we walking in the malls? What's going on with that? How are you walking?
No.
Yeah.
We are actually, we're taking advantage of the partner that we have created with Loppet Trails, Theater Work.
Yeah.
So we're meeting at the front of NorthPoint, and we gather there, and then we just take off walking, and we walk down to Loppet, which is about a mile there and back. For those who aren't as mobile, we have a van where they can get in the van, or we have that, what do you call that trolley thing where someone's riding a bike and you can sit it.
Oh, you what?
We
We have
have-
those too?
Yes, so
What?
it's up
That's
to the
amazing.
seniors.
Okay.
Yeah, so we can all get
Nice.
together. So as we're walking, we're asking questions, whatever
Okay.
questions they have.
Yeah.
And once we get to our destination, we sit in a round circle and we have refreshments. And then we continue to have conversation.
Wow.
And then we come back.
That's beautiful.
So I'm
we
excited.
have some amazing providers here at NorthPoint.
We really do.
I love that we're committed to that. That's an amazing program.
Yep, there's an aging program. It started off with this aging program. I went to one of the committee meetings over at Lopet, and I had just kind of met with some of them at their last annual meeting or something. And the activity director said, she said something on her list to do was to walk with the seniors. And I said, let's see if we can make this happen.
Wonderful.
We're close. Let's do this. Let's get our doctors together, and we're doing it. So we've done 2, and we're going to try to get 1 more in before the weather changes.
Okay. So if anyone's listening and that's something they're interested in, do they have to be already established care with NorthPoint?
Not at all.
What?
So we're trying to, and so we're going to get the flyer together. We're going to decide what date it is. We're thinking more like the 22nd. Normally we do it on Fridays.
Okay.
Normally starting at 1 and we're done at 3.
Okay.
But we're waiting to confirm, and we'll do a flyer, and I'll do a blast out and make sure that the departments have the flyer. But anybody can come and join us.
So they can call, if they're listening, they can call our main number and get some information
We'll
about
make
that.
sure they have it.
Wonderful. Okay, wonderful. Kudos to you. Well, I also want to say, too, when we talk about, let's go back to the provider and establishing care. You know, we have our main campus here, but we're also in our communities. And I want to ask you about our Cora McCorvey clinic, because that is dedicated for our seniors, yes?
Yes, that has been around for a long time. When I first started with Life Course, that's where I started.
Okay.
So I was in that building, and it was very convenient for that work, because there is, at the time, there was a Y, and then there is the day center, and then there's assisted living, all connected.
All right.
I was like, it was the greatest
Great.
job.
Perfect for
Yeah,
them.
because I was moving around, popping around, and seeing them in action, and visiting them. So that was wonderful. So right now, the day center is still there, and then there's assisted living. And then our clinic there. We have our providers that are there to see our patients. And so I know at one point, I'm thinking 50 might be the starting age, because it started up higher, but they've gone down.
Okay.
Before we did our new expansion, it was just a more quiet, more laid back for our seniors.
Sure.
And now it's so beautiful over here and stuff, and you can still get that same peacefulness over here. So it's great to have the 2 locations. But yeah, seniors do have that option. I have quite a few of my seniors that prefer, because, you know, they don't have to think so much far as where to go in. And,
right.
You know.
And these are providers that are dedicated to issues, health concerns that our seniors are facing. I'm going to say geriatric care, but is that correct?
That is
Okay.
right. That is, you're right. You're right.
Okay.
Yes.
Okay.
And so, Miss Dr. Erickson, but he was one of the number 1 providers over there. We had the chiropractor. I must say that it's been a while. I need to get over there and actually visit, just to be updated on really what's still going on. But I know we still have our services over there.
Okay.
And our seniors are welcome to choose that location as well as they have this one. So they have options.
Yes, and here at the main campus, you mentioned about how nutrition is such an important part of our health journey. You know, we have our amazing food shelf here, so that, you know, our seniors can come and get some fresh vegetables and fruits and things to incorporate in their diet. But I'm going to shift for a second. I want to talk to you about, you know, we have a behavioral health arm here at NorthPoint, and I know that mental health plays a very important part in healthy aging. Let's talk a little bit about that. What can seniors do? You know, we're at a time where we're you know, we talked about the isolation and people being disconnected. What can our listeners do, or what's some advice if you're maybe a family member? How do you support our aging population with mental health?
First of all, I always want to put it back to the providers, for them to really keep an eye on our seniors, making sure that the diagnosis, if there's something going on, with dementia, Alzheimer's, and all those things, because they can happen, not all the time. Just because you're a senior don't mean you're going to get it, you're right? So just being mindful of that. But making sure that we do our part as family members, reaching out, making those calls, checking in, doing some live calls, FaceTime, things like that. We need to make sure that we stay engaged, because what we realize when it comes to our seniors, their health and everything depends on that engagement, that movement. The decline happens when you're not doing that. So
when you're sedentary, physically, mentally.
So we definitely be concerned about depression and things like that. So that's why it's important for us to stay connected. And making sure that when we're talking to our seniors, like having the conversation. I think what I've been able to do, and I'm so amazed at, because I'm just me, but I love what I do, to build those relationships. Because they need trust. Our seniors ain't no joke. If they don't trust you, you're going to know it. So building that so that they're comfortable to be able to share, you know, and listen. Listen. Be quick to listen, because some things you might not see, but if you listen, there's some things they won't say, but you'll still
you pick up on it, right? You pick up on the things, Well, I know when we sat down before, you had said to me that this is deep nurturing and emotional work. And I know from my own personal experience, I shared with you that I was a caretaker to my dad for 9 years, who's no longer with us, but it's very deep work. What would you say? We have a lot of folks that, the baby boomers are entering that age. We have a lot of folks like me, part of the sandwich generation, who are caretaking for their parents. Can you say a little bit about any advice or wisdom that you share with our listeners?
My grandma used to say, Mama, as long as you live, and as you live, there's some things you're just going to experience, right? So understanding that there are partners that we have, and there's different organizations out in our community that cater to assisting and helping. Volunteers of America is number one. That's a great partner of ours. They deal with dementia and caregiving support. Letting the families know, or families working with families when we realize and sense that there is a need, offering and finding out what that need is to figure out how we can help them. Volunteers of America is amazing. They do monthly virtual meetings now, and it's all geared to the seniors, and they're staying active. And it's on topics that they are interested in. It's very important that we understand as caregivers that it's important to take care of ourselves.
Yes, that respite care. That's what you and I talked about, right?
It's very important.
Very
it's
that
important.
Giving oxygen back to ourselves before we give it to somebody else.
On that plane. And it's just so natural just to keep going.
Push through it.
But we can't give our best if we don't take care of ourselves. So as I thought about even a personal story, it was dealing with that. And I met this couple years ago when I first started this work, amazing couple. And the husband ended up getting some, I believe it's dementia. So I was able to connect her with some PCAs to come in and help her. Then it got to the point where he had to go to a nursing home, actually. So, but And the wife was so engaged, though. And even after he went to the facility, she was there every day.
Yeah. Yeah.
I kept calling and checking to see how she was doing. Was able to connect her with Volunteers of America for caregiving support. So she knew she wasn't alone.
Yeah.
This senior is amazing. She comes to walk and talk with the doc. She was just a sister spokesman. Everywhere I go, I see her.
Okay.
So, and she still goes to visit her husband.
Wonderful.
So it helped her to realize that she still have life and to take care of herself, and it's okay. And I think a lot of times, especially in our community, there's this guilt.
Yeah. Say it. Say it, sister.
There's this guilt.
We hold a lot of guilt. Yes.
Because I'm supposed to, they did for me, I'm supposed to, but we have to understand that we have to take care of ourselves. And it's the way you do it. Because a lot of our seniors, they're so understanding. You know, a lot of them, and the ones who mentally just don't really understand at this point in life, it's okay. But it's the way you do. So you can still nurture your loved one. It's how you care for them, how you touch them, how you talk to them.
Yeah.
And then you go do what you need to do, and you come back.
Yeah.
And you can continue
Take
to
a
do
break.
that
Yeah.
rather than feeling animosity or anxiety. And
Yeah, that's
Yeah.
so important. Thank you for that. Well, we're almost at time. This has been such an engaging, important conversation. Thank you so much. I'm just going to ask you if you had maybe one or two pieces of advice for someone who's just beginning their journey into their senior years. What would that be, Miss Peggy?
Peggy,
That's right.
you need to make sure that you understand that you're at a different phase and stage in life. You can't do things just the way you used to. You can still do them, but it's how you do them. Just like even with movement, it ain't not move, it's how you move. So I would say give yourself grace and be okay with change, because it's coming. And just be as positive as you can. Continue to care and do for others that as you choose to. But take care of you first, is what I would say.
Wise words. Wise words. Well, I know education is where you started. You're clearly passionate. Thank you for sharing your wisdom and your advice with us today.
You're welcome. Thanks for having me.
Absolutely. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.